Okay, welcome back guys. Let's discuss very interesting case of neuroanatomy. Suppose a clinical scenario is given to you that a 45-year-old man, a known case of the hypertension and diabetes, presented to you with a history of the right-sided weakness. Right-sided weakness, it's mean paralysis, hemiplegia of the right side of the body. So it's mean we are talking about the voluntary motor tract, corticospinal tract. Corticospinal tract or pyramidal tract, if I am writing with my right hand, it's coming from the left brain, because this corticospinal tract, it crosses the caudal medulla. So any problem, motor voluntary impairment on the right side of the body, its problem lies in the left side of the brain. So right-sided weakness, complete weakness. So probably this is stroke of not MCA artery or ACA artery. It's not indicating that injury is above the thalamus or above the midbrain, because if it was stroke of MCA or ACA or PCA, especially MCA, because this is most commonly blocked artery, it could have not complete weakness, it was probably the partial weakness. So it's not a stroke of probably MCA, which is most commonly involved in stroke, and ACA, which supply to the frontal lobe. Probably this is stroke of PCA artery. Why PCA? Because left eye is down, out, and pupil is dilated. Yes. So you guys know that midbrain, this is very important part of the brain, and this is first part of the brain stem, and two cranial nerves originate from your midbrain. Third cranial nerve oculomotor and fourth cranial nerve trochlear. Third cranial nerve supply almost all muscles of the eyeball except your lateral rectus plus superior oblique. So if there is injury to the midbrain, and midbrain, this part of the brain is receiving blood supply from branches of PCA artery. PCA artery. Branches of PCA artery, which is a branch of the basilar artery. Basilar artery. So this is a stroke of PCA artery. So what happened, that patient was having stroke of PCA artery, it means there is problem in the midbrain, and problem in the midbrain, especially on the left side, medial side of the midbrain, and patient is having left eye down and out. It means there is extraocular paralysis, because all the muscles of the eyeball are innervated by third cranial nerve. Injury to the midbrain, ophthalmoplegia. So left sided midbrain injury, left side extraocular muscle paralysis. In addition, dilation of the pupil. Dilation of the pupil, it means loss of constriction. Constriction, this is parasympathetic action of the oculomotor nerve. So guys, this is WEBER syndrome. This is WEBER syndrome. This is your WEBER syndrome. So this type of syndrome is called as WEBER syndrome. Remember, WEBER syndrome, it's basically injury to your midbrain, and especially medial side of the midbrain, and Wallenberg syndrome is lateral side of the medulla. That is different thing. Okay, next please, another very important and interesting clinical scenario number 4. Here you can see it's mentioned here that patient is having problem right deafness plus tinnitus and deafness. It's mean deafness, loss of the sense of the hearing. It's talking about the vestibulocochlear nerve. So right deafness and tinnitus. Right deafness and tinnitus. So it's mean right side brainstem injury at the level of pontomedullary junction, and this is injury to cranial nerve number 8. Yes, injury to cranial nerve number 8, that is your vestibulocochlear nerve. Loss of right finger to nose. Yes, loss of right finger to nose. Patient is having tremor when trying to touch the nose. It's mean right sided injury to the spinocerebellar tract. spinocerebellar tract, right. Right facial numbness. Facial numbness, it's mean no sensations. Sensations from face carried by trigeminal nerve. So right sided fifth cranial nerve injury. Then no corneal reflex, and we know that corneal reflex are carried by V1 ophthalmic, which is the first branch of trigeminal nerve. So injury to the trigeminal nerve also lead to loss of the corneal reflex. Right facial spasms. Right facial spasms, it's mean there is right sided Bell's palsy, facial palsy. This is injury to the seventh cranial nerve. Injury to the seventh cranial nerve. So all these are the clinical features which are associated with the injury of this pontomedullary junction. So this is basically stroke of which artery? Probably this is stroke of, guys, AICA artery. AICA artery, lateral side of the pons, especially pontomedullary junction syndrome, and it might be because of some tumors like schwannomas, or maybe any stroke of this artery. So you have to understand that this is relating to the pontomedullary junction. So you have to watch this lecture and you have to make notes. Thank you for your consideration. Thank you.